Hi, Professor Dub. So I'm going to be using this chair and this bed in this scenario, and it's just going to be one bed. So if I don't lower it while the patient is moving to transfer into that bed, it's just because it's considered one bed in this scenario. It's just because this bed is too high for me to actually do a full head to toe in that, and because we used unders for storage, so we had to raise it. So yeah. So I will start in now. So I have all my supplies with me, and I'm fully dressed and ready to go into the patient's room. Knock, knock, come in. I'm going to open and close curtain for privacy, and I'm going to take out my hand hygiene and do it for 20 seconds. My name is Maxime, and I'm going to be your nurse today, and we will be doing a head-to-toe assessment. There will be involving a lot of touching. Is that okay with you? Mm-hmm. Can I please see your wrist? And can you please state your full name and date of birth for me?
I was trained August 1st, 2001.
Thank you. I'm going to be lowering your bed to my working height. Okay. Upon inspection of the head, I see that it is normal cephalic and it is bilaterally symmetrical. I'm going to go ahead and palpate the scalp. Do you feel any tenderness or pain when I do that? There's patient denies tenderness and pain upon palpation, and there's no masses or lesions found. I'm going to go ahead and inspect the patient's head. I see that it is dark brown and there's no alopecia or any dandruff when inspecting. And I'm going to go ahead and check behind the ear and the nape of the neck, and there's no evidence of any parasites. I'm looking at the patient's face. I see that patient's facial features is bilaterally symmetrical, and that the skin tone goes evenly with the rest of the patient's body. I'm going to go ahead and test for cranial nerve 7. Can you go ahead and raise your eyebrows, frown, smile with teeth, smile with no teeth, puff your lips, and blow a whistle. Patient's cranial nerve 7 is intact, and that there is no involuntary movements or no tics. I'm going to go ahead to the eyebrows, eyelashes, and eyes. Eyebrows are full, consistent, and bilaterally symmetrical. Eyelashes go away from patient's eyes, and it is consistent and full. I'm looking at eyelids, and it is skin is intact, and it is consistent with the rest of the patient's skin tone. I'm looking at the outer canthus, and I see that it is aligned with the pin of the ear. I'm looking, and there's no masses, lesions, or any discharge. I'm now going to be looking patient's eyes. I see that the sclera is white, the cornea is transparent, dome-like, and smooth, and that the patient's irises is black, round, and consistent throughout. I'm going to look at the conjunctiva. The conjunctiva is pink, moist, and there's no sign of redness. I'm going to go ahead and do the 6 cardinal field of gaze. I'm going to have you follow my pen light with just your eyes. 1, 2, 3, 4, 5, 6. There's no sign of nystagmus, and patient was able to follow all 6 cardinal fields of gaze. Now I'm going to go ahead and do the corneal light reflex. Corneal light reflex, both eyes were bilaterally symmetric. I'm going to go ahead and check for pupil response. Pupils constrict to direct lights. Pupils constrict concentrally to indirect lights. Now I'm going to go ahead and do the accommodating test. Can you focus on my light pen? So when patient focuses on objects far away, pupils are dilated, and when it's close up, pupils are constricted. So pupils are equal, round, reactive to light, and accommodating. So cranial nerves 3, 4, and 6 are intact. Now I'm going to go ahead to the ears. I see that the ears are bilaterally symmetrical and consistent with patient's skin color. I'm going to go ahead and palpate the tragus. Does this hurt?
No.
Any pain on the orcal?
No.
Any pain on the mastoid process?
No.
No pain, tenderness, no lesions, masses, and nodules found on the tragus, orcal, and ear. I'm going to go ahead and do an otoscopic test. I'm going to grab my otoscope, pull up and back on the pinna, and I'm going to go ahead, go in. I'm looking at the earlobe, ear canal. I see that it's consistent with the rest of the patient's skin color. There is expected amount of cerumen, and color and consistency goes with patient's ethnicity. I'm looking at the tympanic membrane. I see that it is transparent, pearly gray, and the is at 7 o'clock since I'm looking through the patient's left ear. I'm going to go ahead and go around the patient. I'm going to go 2 feet and do the whisper test. Can you go ahead and cover your right ear for me and repeat the word that I say?
Popcorn.
Patient was able to say, repeat back the 2-syllable word, and that tells me that the cranial nerve 8 is intact. Now I'm going to go ahead and go back to the face, and I'm looking at the patient's nose. I see that it is in the midline. There's no masses, lesions when I inspect. I'm going to go ahead and palpate. Does this hurt when I do that?
No.
No pain or tenderness from the patient, and I felt no masses, lesions, or displacement of the nose. Can you go ahead and tilt your head back for me? I'm looking in. I see no nasal polyps, no deviated septum, or irritated mucosa. Can you go ahead, breathe in and out through your nose for me? There is nasal patency in both nostrils. Now I'm going to look at the mouth. I see that the lips are pink, slightly moist, no peeling, cracking, and the skin is intact. Can you go ahead and open your mouth for me, please? I see that there is no tonsils present, so that is grade 1+. Now I'm going to go ahead and check again. Can you please say off? So patient's uvula retracted up and back. That tells me that the cranial nerve 10 is intact. I'm going to go ahead and discard of this. So now I'm going to go ahead and check for cranial nerve 12, which is tongue range of motion. Can you go ahead and stick your tongue out? Move it up and down, side to side. So cranial nerve 12 is intact. Now I'm going to go ahead down to the neck. I see that the trachea is in the midline, and that the color is consistent with the rest of the patient's body. Can you go ahead, nod your head no? Can you go ahead and move it up and down? And can you touch your ear to your shoulder, both sides? So a patient's neck range of motion is fully intact. Now I'm going to go ahead and check cranial nerve 11. Go ahead, push against my hand. Can you shrug against resistance? Patient's cranial nerve 11 is intact. Now I'm going to go ahead and assess patient's fingers. I see that there's no cracks, ridges. The patient's nail bed is pink. Capillary refill on both hands is less than 2. Skin turgor is elasticity, no tenting. I'm going to go ahead and check for patient's radial pulse, and I would be doing this for 60 seconds, and it is 60 beats per minute, consistent and bilaterally symmetrical, and it is 2+. I'm going to go ahead and have you do this. I'm going to check for clubbing. There is no clubbing, and it is less than 160 degrees. Okay, I'm going to go ahead and check for patient's full range of motion. I'm going to have you flex, extend. I'm going to have you create a box with your wrist. Close it, open, and fly open. Now with your fingers, close it, open, and fly open. So patient's arms, wrists, and fingers, range of motions are intact. Now I'm going to go ahead and test for upper extremity strength. Can you go ahead and pull? Can you push? And can you push up, push down? Can you open your fingers? And then can you go ahead and grasp my fingers? Patient's strength, upper extremity strength is 5 out of 5. Now I'm going to go ahead and test for fine motor skills. Can you go ahead and close your eyes and touch your nose rapidly with your fingers? Can you go ahead, open your eyes, and touch your nose to my finger? Now can you go ahead and touch your fingers rapidly and pat a cake rapidly? Patient's fine motor skills are intact. Now I'm going to go ahead and turn the patient around. I'm going to be checking for the posterior thorax, and I see that there is muscle development bilateral symmetrically, and I see that the shoulders are parallel to the patient's hips. I am going to be auscultating the posterior and the lateral thorax. Please breathe in and out every time I move my diaphragm. Go ahead and close your arms up. So I heard vesicular sounds in the posterior and lateral thorax. I heard no adventitious sounds, which is crackling, wheezing, and bronchi. So I'm going to go ahead and have the patient turn around again for me. This time I'm going to be looking at the anterior thorax. I know that the AP ratio is 2 to 1, and I see that there is no pulsations, and there's no use of accessory muscles. There's no barrel chest, and I see that there is no pectus excubatum or pectus carinatum. And I see that the intercostal margins fall at a 45-degree angle, and the costal margin falls at a 90-degree angle. So I'm going to go ahead and auscultate the anterior thorax. You go ahead and breathe in and out every time I move my diaphragm, starting at the apex. I hear bronchial sounds. One here, second intercostal. I hear bronchial vesicular. Vesicular. I heard no adventitious sounds such as bronchi, crackling, or wheezing. So I'm going to go ahead and check the PMI. You can go ahead and lean forward for me. So palpating, I feel no heaving or lifts. So now I'm going to look at the pericardium. I see that there's no pulsations upon inspection. I'm going to go ahead and auscultate with my diaphragm, starting at the aortic. Starting at the aortic, I hear S2. At the pulmonic, I hear S2. Herb's point, I hear no murmurs. Tricuspid, I hear S1. And then mitral, I hear S1. Now I'm going to go ahead and turn this over to the bell. At the aortic, I do not hear S3 after S2. At the pulmonic, I do not hear S3 after the S2. At the Herb's point, I do not hear diastolic or systolic murmurs. At the tricuspid, I do not hear S4 before the S1. And at mitral, I do not hear S4 before the S1. So now I'm going to go ahead and have the patient lie down. I'm going to be checking the abdomen, and I see that it is in a flat contour and that there is no venous pattern. I am going to be, I see the umbilicus, and I'm going to be separated into 4 quadrants. Starting with the left upper quadrant, I'm going to be auscultating and going in a clockwise motion. So at the left upper, left lower, right lower, and right upper. So I heard normal active bowel movement every 5 to 30 seconds, and there was no hypoactive or no hyperactive sounds. Now I'm going to go ahead and palpate each quadrant, starting with the left upper quadrant, going in a clockwise motion. Left upper is dull due to the spleen. Left lower is tympanic. Right lower is tympanic. And right upper is dull due to the liver. Now I'm going to go ahead and do light palpations. Any pain?
No.
Any pain?
No.
Any pain?
No.
Any pain?
No.
Now I'm going to be doing deep palpations. Any pain?
No.
Any pain?
No.
Any pain?
No.
Any pain?
No.
So with light and deep palpation, patient feels no pain or tenderness, and there is no masses, lesions upon palpation. Now I'm going to go ahead and have the patient dangle feet over the side of the bed. I'm going to be checking patient's legs, lower extremities. I see that the color is consistent throughout the body. I do not see any vascularity. And now I'm going to be checking patient's toes. I see no ridges or crackling. I see that there is no evidence of bleeding. And I see that the nail beds are pink in color, and the capillary refills is less than 2. Now I'm going to go ahead and palpate for post-tibial pulse. It is less than 1, consistent, and bilaterally symmetrical. Now I'm going to be palpating for pedal pulse, which is 1+, and it is bilaterally symmetrical and consistent. Now I'm going to be testing for pitting edema. No evidence of pitting edema. Now I will be doing testing for deep tendon reflex. Right here. Patient's deep tendon reflex is intact. Now I'm going to go ahead and have lower patient's bed. Lowering patient's bed. And I'm going to be testing for fine motor skills. Can you go ahead and tap your toes real quick? Can you go ahead and touch your heels on your shins? And can you do a figure 8? So patient's lower extremities, fine motor skills are intact. Can you go ahead and stand up for me? Can you turn around? So I'm now inspecting the patient's spine. I see that the patient's shoulders are perpendicular to the spine. Can you go ahead and bend over for me, please? Palpating on spine that there is no kyphosis, lordosis, or scoliosis that is present and no deviated spine. And I see that the patient's back is consistent with the color of the rest of the patient's body. You could go ahead and stand up for me. Can you go ahead and rotate side to side? Can you bend side to side? And can you move forward and back? So patient's range of motion of spine is fully intact. Now can you go ahead and stand by your chair, please? Can you go ahead and walk just normally? So patient was in walking tandem, normal gait, and yeah. So can you go ahead and walk heel to toe for me, please? And then can you close your eyes and stand on one foot? Thank you. And then can you open your eyes and hop on one foot? Thank you. So I see that patient's proprioception and cerebral function is intact. Now you could go ahead and have a seat for me. I'm going to go ahead and put your rails up, and I'm going to go ahead and have your call light, and I will be just outside documenting. Before I do that, I'm going to go ahead and hand hygiene for 20 seconds. I am going to go ahead so I have hand hygiene for 20 seconds. I'm just going to go ahead and take all my supplies out. I'm going to open and close curtain. I'm going to be taking the batteries out of the otoscope.